The facial pain, the breathing, the natural nasal airflow, the drainage, those symptoms, which are the most common symptoms, are alleviated very, very quickly. Patients oftentimes come in with their nose completely congested and they walk out an hour later with their nose completely clear, to the point where it becomes very emotional for some of these patients that when they can finally breathe through the nose after not breathing through the nose for 20 years, it's a very emotional moment for them to say, man, I can finally breathe through my nose. I can finally lay down flat and sleep. I can finally, not have headaches when I'm at a restaurant with my friends. I don't have to carry my tissues around all the time because I'm not draining all the time. So the symptoms that patients come in with are very quickly alleviated with this procedure because the healing is much faster with compression versus tissue destruction. With compression, we see the patients healing within 2 or 3 days because the patient doesn't have to go and regrow the lining of the sinus. They don't have to deal with so many scabs, so many post-operative visits. It's a very, very effective treatment for the symptoms. The limitations really are age-related. I think we're down to about, in the office usage of the balloon, down to age just 8 years old. Younger than that's a little more challenging technically, although we haven't explored that as much as we could. And then upper age limits, we've upgraded up to 92 years of age. So really, I don't think there's much in terms of age limits. There are limitations in terms of your general health. If you're a good candidate to do the procedure in the office. If you have a lot of heart disease or other complicated factors, you're probably better done in the hospital. If you have extensive disease that cannot be cured with the balloon, massive polyps or tumors, again, limitations are there. But I would say of the chronic sinusitis sufferers, 95% of those patients are candidates for the in-office procedure using the correct technique, the Honrubia technique, because we have anesthesia, just like you have in the hospital, at hand. That allows us to do those complete procedures. Without the Honrubia technique, I would say no more than 20 or 30% of the patients are candidates for in-office balloon sinuplasty because of either anxiety issues, inability to tolerate the pain, problems with the septum or turbinate that you can't fix without the anesthesia. So our patient population is much broader using the Honrubia technique than the patient population without the technique, because we have anesthesia and ability to take care of other issues that cannot be done under local anesthesia. It's remarkable to see the people that come in after being mistreated, misdiagnosed, medicated for years, come in and have a 15-minute procedure and changing their whole life. So it's not just changing their symptoms of their sinusitis, it's changing their lifestyle, changing how often they have to go to the doctor, changing how they sleep, changing how they perceive their health. So it's remarkable to watch these people make a transformation once their sinuses are fixed. And what's even most remarkable is that since the procedure is so short in duration, you get results so quickly, you get a lot of feedback very fast of how the patients did with the procedure. Versus the traditional surgery, it may take 2 or 3 months to get the results. So it's not as dramatic as an impact on the physician when you have to wait 3 months to see what happened versus when you have to wait a week to see what happened. So it's amazing. People come in 2 weeks after procedure and almost all the patients, that's their last visit. They're done. So you don't see these patients hanging around weeks and weeks and months on end. You do the procedure, you bring them back in 2 weeks, and the majority of patients, that's it. They're gone. They're fixed. So it's a remarkable healing phase, and in addition, I think provides dramatic results very quickly, so the enthusiasm of the patient and the physician is very high because the results are so powerful. The American Sinus Institute solves sinus problems.